Hello, my name is Davrin Bakirkhanov. I'm a senior student here at Penn State studying petroleum and natural gas engineering. Today I'm gonna give you a solution talk, and before I get started, let me ask you a quick question. Does any of you have relatives like parents or grandparents whose age is between 60s and 70s? As we all can see, almost everybody has a close relative in this age of range. And now let me tell you the fact that based on the National Parkinson Foundation, the average age of Parkinson's disease is 62 years old. But there are some cases when people age of 30s and 40s get Parkinson's disease, which is called young onset Parkinson's. As I said in my topic proposal and problem speech, I'm a big fan of Muhammad Ali. And personally, I have practiced boxing as well, and when I started researching more deeply about the Parkinson's disease, I came up to the article published on the London Neurology website that despite decades of intensive study, scientists still do not know the cause of Parkinson's disease. And since Parkinson is age-related disease and the causes of this disease are not still unknown, this topic become a personal concern. So being influenced by the legendary champion and being socially responsible for the future health of my parents and grandparents as well as yours, let me tell you the fact that there is a new innovative solution to treat the Parkinson's disease. So today I'm gonna go over the new innovative solution treating Parkinson's disease, which is gene therapy. First, I'll give a brief introduction about gene therapy and explain what is it in a simple way. Then I will go ahead and explain the efficiency of this new treatment, which is long-term efficiency, and another one is that it has a disease-modifying effect rather than just simply relieving the symptoms. So, what is gene therapy? Based on the article published by Kurt De Vos, he's actually the head of the research center in the King College of London. He said that Parkinson's disease is a new innovative solution to treat the Parkinson. The gene therapy is a new innovative solution to treat the Parkinson's disease. As he says, we use the gene therapy instead of drugs, and he actually goes to the procedure and explains how they do this step by step. First he says we get the blood sample of the patient, then we generate a gene. In other words, we can say that the program the gene that will work with this specific blood type. And he also mentions that while they're making the gene, they take into account the aspects like blood viscosity, age of the patient, and the blood type as well. After they generate the new gene, they put it into the blood sample and again inject it to the patient's body. Then inside the circulatory system, these genes goes to the brain, and there it starts working. And how it's gonna work, I will explain in the next step. So Andrew Jagan, he's a neurologist at Feinstein Institute of Medical Research in New York. He actually explains how the gene therapy works. As he says, we insert the glutamic acid decarboxylase, which is in other words GAD, into the body of the patient, and inside the circulatory system it gets to the brain where a subatomic nucleus located. And he says this subatomic nucleus is the most important point treating the Parkinson's disease. So if the brain is sustainable for the inside the subatomic nucleus, then people won't have the Parkinson's disease. So as he says, this goes to the subatomic nucleus, which is the main point of the brain part for the Parkinson's disease. And he actually did a very good experiment which involved 46 patients. He divided his patients into the two teams. One team had a brain surgery, and another team had a gene therapy. So after 6 months passed, he and his team examined both sets of patients by looking at aspects like gait, posture, head and finger movement. And the results are shown on this graph. people that underwent the gene therapy, the improvement showed to be 23%, and people who got a brain surgery, the improvement was only 12.7%. And by this experiment, Andrew Gajan, he actually shows that the gene therapy, it's effective way of treating Parkinson's disease in the long run. So, as I said, gene therapy doesn't help on the long run, but also it helps to actually modify to treat the disease. So Michel Kaplan, he's the surgeon neurologist at the Cornell Medical Center, and he's actually the director of Parkinson's Disease Today journal. He says that he made an experiment. It wasn't actually an experiment. They was looking after the patients who underwent the gene therapy, and as he said, in the first months, like when they only had the gene therapy, their brain motor was sustainable for 25%, but after 12 months their brain was sustainable for 65%, which actually shows that when they had the gene therapy, it started affecting their body, and this, as you can see, it was affecting for 25%. But after time passed, it was actually 1 year, which is 12 months. The effectiveness of gene therapy didn't decrease; it was still increasing, and it went to the very huge difference, which is 65%. He also says that, which was encouraging to their team, is that people were always taking the treatment. They're always taking the drugs, levodopa drug, and they had the gene therapy. And he also says that, as we can see, gene therapy, it actually provides additional improvement to the drugs. And by this experiment, he actually proved that gene therapy has a modifying effect treating the Parkinson's disease. So in conclusion, today I'll talk about the gene therapy as a new innovative solution treating the Parkinson's disease. First I explained what is gene therapy, then I went to the second step, which was the long-term efficiency of the gene therapy. Then I provided a couple of examples. After that I went to another step, which was the disease modifying effect of gene therapy. So by telling the last experiment done by the Gate, Michel, I actually did show that the gene therapy modifies the disease, and it helps to get the symptoms go away, and actually does relieve the symptoms. So at the end, I would like to tell that I hope that in the bright future, in the near future, people would experience the full benefit of gene therapy, and a lot of people will benefit from this, because as we know, in United States in 2010, $14.4 billion were spent on treating the Parkinson's disease, and number of patients in 2010 was 630,000 people, which is a big number. And I hope in the near future we'll be able to experience the full benefit of gene therapy, and this number of patients will decrease dramatically. Thank you very much.